Ladies and gentlemen, Jason Cesar.
Look, yeah. Today
All
we're
right.
going to talk about testosterone. So, I mean, you just went right into it. You
All right.
big aggressor, you ogre, you.
Let's talk about testosterone.
Okay.
Why do you think people are doing the weight loss thing and, the medications if they need to? That's another big thing. A lot of people for the last few years, a lot of my friends I've noticed have been taking testosterone. Because we're talking about this, I intentionally didn't wear a hat. I'm balding, right? I'm sagging a little bit, in some areas. I notice I don't build masses fast lifting weights and stuff. When I went in to see one of your partners there at the Affinity, my provider, she mentioned I should probably get a test for testosterone and just see where it's at. I'm in the range, but I'm on the low end of the range for people my age. Is this something as new as the weight loss stuff, or is this something a little bit older than that? Tell me about what's going on with testosterone.
Yeah, so testosterone replacement therapy has been around for a long time. Now, of course, with direct-to-consumer advertising, there's been a significant increase in testosterone replacement therapy prescriptions and clinics. We have clinics all around. There's Synergenics, there's med spas, there's, my clinic, we do replacement therapy. So yeah, it's becoming a trend where people are, I have patients all the time that come in and say, hey, I want you to check my testosterone. We have to be, there's some knowledge that has to be known there. We can't just test your testosterone to test it yet. Okay. And what I mean by that is your insurance company. I can test your testosterone all day long, right? No problem. But you might get a bill for it from the lab because your insurance company, there are certain codes that would be needed or diagnoses would be needed in order to check it, right? So if you're a guy, I'm 50 years old, and you come into me and you tell me I'm fatigued, I go to work, when I come home, I'm just exhausted. I pass out on the couch watching TV every night. Sex just really doesn't interest me at all. It's, my wife's interested, but I just have to like drudge through it. I'm overweight. My erection quality is not the best anymore. Morning erections is something I never experience anymore. These are things that starts making me think, okay, this is a person that may have low testosterone. In having low testosterone, puts you at certain health risks as well. There's demineralization of bones, so it puts you at risk for osteopenia, osteoporosis. There's some cardiovascular things involved there. There's lots of things, right? So vitality, that's a big thing both for women and men. Anti-aging, everybody wants to be forever young, right? And so, when it's needed, testosterone replacement can be life-changing for people. I've seen it. I've seen it restore relationships and marriages. I've seen depression, go away with testosterone replacement. Men and women both getting into the gym and begin to exercise. They have the motivation to do that. They begin to be able to build muscle mass and reduce their fat, concentration. So yeah, it's a huge topic. It's a huge benefit to patients who need it. So the other problem is when you got somebody that wants the replacement but doesn't really need it. And that's where things can get controversial because labs give you a reference range of what is normal, right? And the range would go from, say, 350 or 300 up to 1,200. Well, that's a huge range. What's optimal for you, right? So the diagnosis of low testosterone or hypogonadism is when you've got three.
You gotta say that again. Hypogonadism.
Yeah, hypogonadism.
My dad used to say gonad, and I thought it was a made up word.
No, it's a
What the
real.
hell is that?
It's a real thing. So your gonads, right? Your testes.
Those your balls?
Yeah.
I'm such an idiot.
Right, is what
Chase, cut that out.
produces, right? Produces the testosterone. It's an axis with the pituitary gland, hypothalamus, and your testes or gonads. And so sometimes there's a breakdown, right? But we as healthcare professionals have to figure that out because it's complex. You could have what's called primary hypogonadism, and then there's secondary hypogonadism. So we run into a problem when somebody comes in and they're 25 and they say, I have low T, or I feel like I have low T. I want to be checked. We check them. They have low T and on one occasion, and then we throw them on testosterone replacement. The problem is they may have a pituitary adenoma in their brain, a little brain tumor that's causing it. And it's not this problem with their testicles.
How do you test for that?
Well, there's lab tests that give us clues.
Okay.
So that's why you just have to be careful because I've seen it where I've talked to other people. I had a father who brought a male to me that the kid was 17 years old and went to one of these clinics, testosterone replacement clinics, and they tested him one time and he was a little bit on the low side, low 300s. And
At 17?
Yeah.
That seems like it might be a little bit on the low side for a 40-year-old.
Well, it depends also. Your testosterone peaks about 10 o'clock in the morning, right? So if you come draw your blood at 5 o'clock in the afternoon, you may have a little bit of a trough in your hormone, right? So the general public doesn't know that. So if I draw your blood late in the afternoon,
It's always going to be low.
I can make it, say what I want it to say. So they want to put this kid on testosterone replacement hormone, right? And they prescribe it for him and send him on his way. Well, that's abnormal. To be 17 and have a low testosterone, right? That's not a normal finding.
Is he an athlete?
He is an athlete. But, we have to do some other further testing. There's a hormone called luteinizing hormone, and then there's follicle stimulating hormone. And so there's a indirect relationship, right? So if you have a low testosterone concentration, we should find a high luteinizing hormone concentration, which shows me that's kind of normal, right? Because the brain axis and the testes is communicating with this inverse relationship. That's more of what we call primary hypogonadism. But if there's not that abnormality found, you have a low or normal luteinizing hormone and you have a low testosterone, that's a problem. And we have to do further investigation, maybe even an MRI of the brain. And so you got to be careful when you go to these direct consumer clinics. And
I did that, and I went in, and I was right in the middle of the range. I was, 5 years ago or whatever. I was right smack dab in the middle of the range. I mean, I felt vibrant, but my buddies were like, "Hey, you got to get on the, go get checked for low T, all that kind of stuff." So I went into this clinic, and it was like at the end of a strip center, and tiny little office with all the stickers in the window, And I went in there, and the nurse practitioner across the table, she said to me, "Well, it could always be better."
Yeah.
And I was like, "What's going on here? Wait, whoa! This is a medical decision here. What do you mean it could always be like? You're gonna, And so I kind of, so I was like, "Well, I'm not doing this because I didn't feel like the person was really looking out for my interests. They were more interested in selling me something at that point."
So, I mean, there's risks involved, right?
Yeah.
There's young men who want to be on testosterone replacement, and their testosterone may be low. But you have to counsel them and say, by taking testosterone replacement, we're going to reduce your sperm count. And so there's been patients who are trying to get pregnant. They're trying to have a family. And they go on testosterone replacement and they can't get pregnant.
Oh, man.
I've heard that. I mean, I have one story direct.
So, there's things there's a lot that goes involved, right? But if the testing's done appropriately and the patient has suboptimal hormone levels and they're symptomatic, like I said, they have sex, once every 6 months on a birthday type of thing, that's not normal and that's not healthy in a relationship. And it could be hormonal. They're depressed. They don't want to work out. They're overweight. They feel like crap. They're brain fog is another thing, brain cognition. They're walking into the room and can't remember why they walked in there all the time, that kind of thing, missing what they're trying to say all the time. Could be a hormonal imbalance. And so for those people, it can be extremely beneficial, and it can really help their quality of life.
If you get on hormones or hormone replacement therapy, so you decide that this is for you. So like for me, I've had my stuff tested. I'm, on the low end of the spectrum, and I'm considering it. Is this something that where you can get off of it at some point, and your body will start or once you do it, that's it?
So what I always tell patients, because I get that question all the time, you're just going to go back to your baseline. So we augment your hormone by giving you more hormone. And let's say you're at 350 or 370, right? And the nurse practitioner says you can always be better, right?
Yeah.
And we bring you up to 1,000, and you feel fantastic, and you're doing wonderful, and you're working out, and your sex drive's through the roof. You're chasing your wife around the house again, this kind of thing. And then 6 months later, you're like, I don't want to do this anymore. Fine, that's fine. It's safe to come off. But the issue is you're going to go back down to that low 300 again, and you start feeling the way you felt.
Well, and then the long term of that too, right? So most people, like in my case, there was a lot of, when I first come to see you, there was a whole lot of things that was wrong with me. But, having low T, right? Hey, stop your jokes. Stop your jokes.
A lot of things. Man, what a patient! You only need one patient. You need this guy.
I'm all about small business, baby.
Yeah.
So
I appreciate
putting that new furniture in the front office.
So, but what I'm saying though is that with all of this stuff that's health related, whether we're talking about weight loss or low test, whatever, it's not an overnight thing that you start to feel bad. You know what I mean?
Mm-hmm. Yeah.
So
it's insidious.
Very
insidious.
Start a replacement, or if you start whatever it is, and then even antidepressants, right? Whatever it is, it's not a light switch, right? So if you decide to come off of that, you're not going to start. You know what I mean? Your testosterone might drop right away, which it will, but it's not like you're going to overnight be, oh, this sucks. So what I guess what I'm getting at is, and maybe I'm off base, but it seems like that's going to lead into, when you go see the doctor, you're feeling bad because of a length of time that this has been off. You know what I mean? So,
well, sometimes a fish doesn't know that he's wet, right?
Yeah.
So it's just the way you live. And, that's where I start asking questions. One of the two things I ask a patient, especially a new patient, is how do you sleep?
Mm-hmm.
And do you exercise? And that leads into, well, my schedule, I'm busy, when I get home, I'm exhausted, and I'm looking at you, right? I can tell a lot just by looking at you. You've got some risk factors, right? Yeah. And I start asking, well, tell me about your relationship with your wife. Well, it could be better, nothing's perfect and all that. Well, how many times do you have sex? Well, when's the last time?
If you got to look up, that's a big.
when's the last time? And you'd be surprised how many people middle-aged that tell me they don't. They don't have sex.
I'm not speaking for my life, but I wonder if there's a lot of guys that go, you should see my wife. She needs to be the one that's in here, or the wives with their husbands.
Well,
it's probably a great referral source.
I mean, he's not talking about you.
I know, but a great referral source.
I have a lot of young men that come in that have erection quality problems, libido's low with their girlfriends, and the whole cause is pornography addiction.
Really?
Yes, and it certainly can reduce your testosterone concentration.
That's interesting.
Yeah, that's a whole big topic.
Yeah, that's a whole big topic. One thing real quick though, and so obviously with your sex life, your love life, your relationship, there's some huge benefits there. You mentioned muscle mass, obviously testosterone,
bone density.
Bone density. Mm-hmm. Is it going to grow my hair back?
No.
Okay, so that's off the table. That's a fair answer. My last one then is, what about weight loss? You mentioned weight loss. Mm-hmm. So we just did the 2 episodes on weight loss.
Yeah.
So what it can actually help with weight loss?
So it's not going to directly cause you to lose weight like the hormone GLP-1 that we talked about, right? But it can indirectly by giving you the energy and the motivation to work out. Plus, it's going to help with your metabolism. It's going to help you build muscle mass. More muscle mass requires more increased metabolic rate. More calories are burned, more muscle you have, right? So indirectly, it can help with weight loss. Absolutely.
So so like for me, I've never, done blood tests for all these type of things until I went into your office, but and so looking at a 50-year-old guy, my testosterone's a little bit low. I am still kind of losing weight. I exercise every day. If you're going to pick one, well, why don't we try the testosterone first and see how your body reacts? Or is it often that you put people on both at the same time?
Yeah, it depends on what they need, right?
Okay.
So if you come to me and your testosterone is 150,
Yeah.
right? You're overweight, you eat like crap, and your mood is bad, right? And you just sit on the couch when you come home from work. It's all you can do. We're going to look at you holistically.
Okay.
You probably have sleep apnea, so we need to get you squared away for that. You probably need to be on a GLP-1, some type of weight loss hormone help there. And then, if your testosterone's 120, we've got to bump that up. We've got to increase that.
I'm 8 pounds away from where I stop snoring. Think about that for a second. I'm 8 pounds. If I lose 8 pounds, if I get down to my optimal weight since, I've met Amy in 2015. So the last 8 years, I was 8 pounds lower. I quit snoring. I didn't snore. And so that's my immediate goal, because I don't want her to run off because of that. And this quality of sleep. Right. And so, and if I can do that, then I don't have to go do the sleep apnea and all, because weight and sleep, has to do with sleep apnea.
Sometimes, yes.
Yeah.
Absolutely. It's a risk
factor. And for me,
factor.
I know there's a number because I've been there before and it wasn't an issue. So,
so sometimes we put people on all therapies that are needed at the time for the individual.
Okay. But is it common for somebody to say, well, let's start with testosterone. You're making some progress on your weight, and then we'll look at the other one. That could be an option.
So that's a conversation.
All right.
It's like, what are your goals?
All right. Then the next thing is
Hold on. Why do men get morning erections? Why do men get morning erections?
That's a great question. Great question. So
I got good ones too.
testosterone
you
peaks.
got good morning wood? You got good questions.
I got both.
Yeah.
All right.
So testosterone peaks in the morning, before 10 a.m. in the morning. And that's part of the reason that they get a morning wood. And it also is one of the first indicators of a low testosterone. If you're no longer or infrequently experiencing morning erection or AM erection, your testosterone may be low, and it probably should be checked.
Right. And then you so if you great question, by the way.
I'm here all
And it gives you opportunity for your partner there. It's like, hey, this is convenient.
Well, I mean, it's like, this is probably TMI, but I like having sex in the morning. And I guess that makes sense.
It starts the day off great. It's a good way to start the day.
And there's probably something, genetic going back to the caveman days.
Yeah, of course.
And the whole
Yeah.
thing, where
There's
in the
all the
morning there was
evolutionary
energy,
theories
you
and
didn't
so
have
on.
to hunt food and all that,
Right.
whatever. And so going back to, so now you've prescribed this to me, let's just say. And so do I have to give myself a shot? Can I take a pill? Is there a powder you snort? How does this work?
That's another good question. So there's many forms of testosterone, right? Some people do gels or creams. Some people do oral, like troches, like a lozenger. Most people do injections, especially males. There's like a cypionate oil that can be prescribed that you can do a shot once a week or once every other week or, that kind of thing. And then there's subdermal pellets, that can be inserted in the skin that helps keep your hormones a lot more balanced than, you do the creams, you got to do it every day. Okay. The other thing with creams is the risks is involved is transferring that hormone. So you got grandkids and you're hugging them, you can transfer the hormone to the kids. Yeah, it happens. Or to your pets, you can do that too. So the
Nobody that has a pit bull needs to be using creams.
the creams I don't typically prescribe in my clinic, but there's others that do. There's gels. There's a testosterone gel. The oral formulations, I do a lot for females, but not very much for males because it takes so much. You need quite a bit of it, and they're not that effective. The bioavailability oral isn't that great. The two main forms I use in my clinic is injections and subdermal pellets. So, there's a little bit of risks involved with the injections, more than I would say the subdermal pellets. Subdermal pellets are sustained release, whereas the injections, you've got a high concentration initially after the injection, and then over a week to 2 weeks, it begins to start coming back down, So there can be some mood dysregulation with that. There
great.
also can be different levels of hormones. So you get your shot and the next day you're 1200, but a week later you're at 300. So there's a lot of ups and downs that can kind of go on. Then there's something called erythrocytosis or secondary polycythemia. You can develop too many red blood cells. Okay. And so you have
the injections.
With the injections.
And I know that's bad.
Well, yeah.
I've heard a lot about that more recently.
So you have to be monitored, effectively. I have a patient that recently came to me. He was getting testosterone. He wouldn't tell me where from, but injecting way too much, and his hemoglobin was over 20, and so he's at risk of a stroke or
what's a normal hemoglobin level?
Like 13, 14. And so I had to tell him, we've got to do some donation of blood, but his levels were so high, the blood bank wouldn't take his blood. So I had to send him to a hematologist to have blood, it's called therapeutic phlebotomy, to have blood taken out because he's such at a risk of having a problem. So there's risks involved. You don't want to just go to the gym and get it from your buddy Joe, The other thing is, with the shots, sometimes you can have some prostate kind of enlargement. You get some symptoms there of prostate hypertrophy. You can also produce too much estrogen. So, we have to watch that. So the testosterone can convert into estrogen through aromatase. And so we have to watch those numbers. So there's a lot of things that go involved with the injections. Of course, we monitor anybody that's on therapy.
I hear the back pellets are the way to go. Is that like a 10-minute procedure?
10 to 15 minutes, yeah.
You basically make a small incision, dump the pellets in there, stick some glue on it, bandage it, no showers for a couple days.
That's right.
Okay, perfect.
Yeah.
And the pellets, is that like a 6-month dose?
Yeah, and typically for a male, it's going to last about 6 months.
Okay.
So
and just getting on the last question I have on this is the the price. I think it's important when we talk about medical and prescriptions and stuff because people are freaking out when they get some of these medical bills lately.
Right.
This is like a $500-$600 every 6 month out of pocket.
For a male.
This has really become affordable.
Yeah, it's between $500 and $600 every 6 months for a male. Of course, you have the convenience. You don't have to give yourself a shot every week or every other week.
Yeah.
You don't have the ups and down fluctuation of the levels. It's pretty basal, so it's sustained release over a long period of time. And you don't even have to think about it. So it's more in line with the endogenous hormone level, the way it should be with a testosterone replacement. So, the shots sometimes are covered by insurance, sometimes not. Can be anywhere from $30 to $60 for a vial. Plus, you got to get the needles and you got to get the syringes. You got to do more blood work. So we got to monitor a little closer with the shots than we do with the pellets.
Well, and does insurance ever cover testosterone replacement?
Like I said, sometimes it does for the oil, for the injections.
Okay.
But typically not for the pellets.
Okay.
The injection versus the pellets. One of the things that you told me that I think is that I really appreciated was the pellets are your body sees them more natural, right, or something along those lines. So the injection is a synthetic oil. Your body knows this, right? It's more bioavailable, I think is the term used.
So the pellets are what we call bioidentical.
Bioidentical.
So the molecular structure of the hormone is the same, identical to the endogenous hormone. that's produced by your body. So the body, utilizes it as it would its own hormone.
More efficiently. Of
Exactly.
course, yeah, that makes
That's
yeah.
bottom line summary is it's more efficient.
Yeah, way more efficient because it's closer to the actual thing, right?
So the injections, testosterone replacement therapy, TRT, in the broad sense of the word steroids, would you say that that's steroids?
Oh, it is a steroid.
So would it be the steroids that the bodybuilders use, just in a smaller?
Sometimes they'll use cypionate oil, but they use other things too that
Oh yeah,
are,
it's just one of the things in their stack.
Exactly.
So I guess the thing about the injections is, like these bodybuilders are having a lot of health issues later in life, right? Because but it's because of all of the things that they're doing and the high volumes of things that they're doing them. Is that right?
Absolutely. And a lot of times they're not being monitored or supervised medically.
Right.
And so they're getting it from their buddy Joe, and they're
taking
following
estrogen
his
blockers
advice,
and,
and they're cycling on and off, and so yeah, there's definitely, and especially if you don't need it, right? And so if your body's naturally producing it enough on its own, and then you start introducing exogenous hormone, that's where you're going to get all kinds of imbalances, right? And we do have some people that have burned out the access between the communication of the brain and the testes. And so from now on, they will have to have hormone replacement for the rest of their life because they've damaged their body so much, And so if they don't have it, there will be deleterious effects.
So I guess my point was just that, I think that I've heard a couple of people in my circle, you talk about testosterone getting low T, the knee jerk is like, well, that's steroids. Steroids are bad, So
Well, think of it like medication, right? So for people who need it, just like in the same sense, some people need to take blood pressure medication, but if you don't need the blood pressure medication, it can be bad for you, right? But if people who need it, it can be life-changing. It can be a wonderful therapeutic therapy for people. Like I said, in females too, where a lot of females, getting around menopause, or after having a bunch of kids and stuff, their sex drive is extremely low.
Yeah.
that might be PTSD, though.
PTSD, really.
And sometimes this causes strain where the husband, right, masculinity is kind of like, well, she doesn't want me.
Yeah.
She's not attracted to me, and that's part of a man's sexuality is pleasing a woman. It's pleasing their wife or girlfriend, right, or whatever. And so a lot of times when a female's testosterone is so low, you don't want to have sex with somebody that's just laying there, right? There's no enjoyment. There's no so then the male automatically thinks they're cheating or there's something wrong with me. I'm not.
No, you want to have it hanging off the rafters like you're in your 20s and 30s.
Well, you start to feel like you're not good enough.
Yeah,
right?
That's 100% right.
And so I've had couples that come into the clinic, and I tell them, this is not you, and this is not you. This is a hormonal problem.
Yeah.
Right. And we correct that hormone, and all of a sudden, their sex life's wonderful, and their husband's like happy as can be, and the wife's happy as can be, and things are great.
Are the pellets that you install, if the pellets that you prescribe for men, are they the exact same medication for a woman, just a different volume, different dosage?
Yes.
So it's the exact. So women use the exact same hormone.
Yes.
Is there any natural things you can do to help with hormone besides, testosterone? Exercising obviously is massive. I've read up on that.
Yeah.
But there's no superfoods, or is there a super, can I drink a ginger shake?
There's lots of things at the GNC or local health food store that's going to say testosterone boosters. There's lots of supplements and things, and there's not been a whole lot of large scale random controlled trials to really see the scientific evidence or efficacy of those things.
It's not like the weight loss where you can recommend a couple. It's it's a lot of snake oil at this point.
Yeah. Okay. And so some people swear by them, and it's like whatever, but there are some natural things that you can do to increase your testosterone. So one is lifting weights, resistance training. So lifting weights has been proven to increase testosterone for both men and women. Being consistent with it, right? Intermittent fasting has a release and uptake of growth hormone in the muscles, and also has an increased production of testosterone. So intermittent fasting combined with exercise can increase testosterone production. Eating a whole food diet alone, right? So we're dealing with a lot of endocrine disruptors. So there's a lot of chemicals even in our clothes, in our laundry detergents.
Wow.
Chemicals
Chemicals in your clothes.
Yeah.
Like what the clothes are made out of, or like detergents?
Dyes.
Wow. I didn't even
There's
think about that.
petroleum-based, oil-based things that disrupt the endocrine system. Birth control pills, can disrupt the endocrine system. And so there's lots of things that can cause dysregulation of hormones that if you're just living a whole, full, healthy lifestyle is going to increase your testosterone naturally. Now, are you going to be able to go from 300 to 1,000 doing that? Probably not.
But if you're in your early 40s and you notice some changes, get out there and work out.
Start exercising,
yeah.
start eating healthy, sleep 8 hours a night.
I'm going to say that probably exercise is not ever a bad thing for your overall health.
It might only be 10% of weight loss, but man, I'll tell you what, that's the one thing, it kept me off
sustained
of blood
weight
pressure.
loss.
Yeah,
It is sustained weight loss.
I mean, but it's not 10% of your overall health. I mean,
no, not at all.
That's
No.
a big difference to understand. We talked about the 90-10. It's just the weight loss portion is the exercises that we were talking about, not your overall health. Health it's way more important.
Absolutely.
It does more than just weight loss.
Oh yeah, mental health, mood, sexual health, you name it.
And, for me, and it also is like a mental health break too, because I get to listen to this podcast, when I'm walking. I have earbuds and I listen to the, local talent,
Network of
specifically
podcasts.
the local politics show is my favorite. But maybe this will replace that. So, but thank you, Sean.
Yeah, no problem. My pleasure.
Filling us in on, on testosterone, and of course, with everything, see your healthcare provider. I mean,
Absolutely.
When you go to see your nurse practitioner, when you're at Affinity or, your doctor's office or whatever, ask them about this stuff. I mean, they're there to answer questions about this.
Hopefully.
These people should be experts.
They should be.
I am probably more pessimistic by nature. I feel like, how do you get over the stigma, or maybe you don't, and maybe it's not an issue in your clinic, but it seems like I would venture to say people might feel like you're just trying to sell them something.
Mm-hmm.
And it's like, I really appreciate that about when I go to your place. It's you're presenting data to me, and I'm a data nerd, right? So it's just, hey, look, this, 2 + 2 is 4. It's this is how it's going to affect you. This is what it might do, might not, whatever. So I personally don't ever feel like I'm being sold when I walk in the door over there. But there are people and there are places where I'd imagine that can be a problem.
Mm-hmm.
You know what I mean?
Absolutely.
So like the places that you'd mentioned earlier on the end of the strip center, which I didn't know you was going to say center.
It wasn't a strip center. I thought it was a drive-through liquor store. But it was actually a testosterone replacement clinic.
Yeah.
So the thing though is that if I think that it's important to be cognizant of that. I'm just I think everybody's a car salesman. You go to a car. It's like their job isn't to make sure whatever. So I guess my point is with you, I don't ever feel that way. But do you ever feel like you're combating that with your patients?
I try really hard to holistically look at each patient. And so if you go into a place and new concepts are introduced to you right off the bat, dealing with things that, problems that you don't even have, that can be a pause for caution,
Red flag.
So what I mean by that is like testosterone replacement doesn't come up in every conversation with every patient.
Of course.
It's a natural flow, right? So I'm looking at you holistically. Again, how's your sleep, right? How's your mood? How's your diet? What's your lifestyle like? And so as we go through some of these things and we discover this person is at a high risk to have a low testosterone. And then, so we talk about that. Hey, Joe, you may have a low testosterone based on what you've told me. You don't have morning erections. You feel like a slob. You eat bad. You don't want to have sex. These are things that can be an issue.
Yeah, lead
right?
to a miserable existence, honestly.
Right,
I mean,
right. And they're just thinking this is the way life is,
Yeah,
right?
This is what happens when you get older.
Right. And so then we test them. Again, now I have data to present. Hey, Joe, your testosterone here is 250, okay? And you have all these symptoms, right? This is something we can maybe benefit with. What do you think about that? And so I'm not trying to sell them something. I'm trying to tell them this can benefit your life.
Right.
Is this going to be of value to you or not? And if it's not, that's fine. That's fine. As long as you understand the risks and benefits of going either way. And I've had several patients that their testosterone is low. It's 200, but their energy is great. Their sex drive is great. They feel fine. There's nothing wrong. And I tell them, well, what we're dealing with here are numbers then, right? And so, yes, there's an increased risk of certain things with a low testosterone. Like I said, osteoporosis, bone density, depression, things like that, heart, cardiovascular disease. But you're not symptomatic. Why am I going to try to fix something that is, in your case, in your life, the way you feel is not broken? Right? So I'm not going to push the envelope here. There's no reason to. So again, if you go into a clinic and before you even sat down, they start trying to sell you their supplements, they're trying to sell you, testosterone hormone replacement. I didn't even talk to you about how you feel.
Right.
There's no
Red
data.
flag.
Right. They're selling you stuff.
Right.
Right. At the end of the day, these are businesses, right? My clinic is a business. It helps feed my family and, and stuff like that. So I have to make money, but there's a balance there of being beneficial to the patient, giving them what they need for that individual versus trying to push things on people.
Right.
We do IV replacement or IV therapy at my clinic, but that's something that maybe I talk to 5-10% of patients. I don't talk to every patient about it because not every patient needs it. Right. So,
Yeah.
I mean, could we probably sell it more? Probably. But it's not something I don't go to work to try to be a salesman.
Right.
I go to work to increase the quality of your life.
and pay your medical bills for school. I mean, you went to college for a long time. You're
Went to
back
school.
in school. So
Yeah, I have a
you know,
lot of medical debt.
So
you
when are you up for graduation? I guess.
So 2 more semesters. I finished this semester August 4th. 2 more after that, and I'll graduate.
And then what are you going to graduate with?
A doctorate of nurse practice,
Okay.
DNP.
DNP.
By the way, should I mention right now, after you're done in this corner liking and subscribing, you can read down in the comments and you can always find Affinity Care's website. And you can contact Sean or email the clinic or call over there if you have any questions or
Sure.
you want to go see him. He's
Absolutely.
available all the time.
I traditionally have not been a healthcare seeker, a professional healthcare seeker. And then I remember when I first come to see you, you did really good things for my mother, and it's probably creepy of me, but my mom was the guinea pig, and I was happy with the results, so I decided to take and go further with it. Whenever we first did blood work, I was just terrified. I was just like, I don't want to be here. They're going to find all this stuff, and there's all these problems. But being a data nerd, it was like after I got that, and after we sat down with that, it completely changed my perspective and my outlook and my everything. And just having that information, it was such a relief because I was like, this is all manageable stuff. And so, like, this testosterone is no different. Whenever we talked about, going forward with that, it was just like, it's just data for me. And it's like, it was just, I don't know, man. For most of my life, I wouldn't go see a dentist. I wouldn't go see nothing or nobody. Is that an apple? I'm just completely different person because of data that you guys provided. So I don't ever feel like you're selling me anything.
I appreciate that. That's what I'm aiming for.
And so, that's the point I was trying to make, was that, if you go to a place that I don't even want to say specializes, but we talked about the salesman aspect of that, and I don't ever feel like that. And I feel,
What are you talking about over there? Listen, after you're done liking and subscribing, click the link below to get to the new Affinity Care website. It's beautiful. It's up. Get a hold of Sean.
all right, I think we're good. That's
right.
a wrap.